In health matters, the Lagos State AIDS Control Agency has unveiled plans to stop the spread of HIV among children as part of measures to end AIDS in the country in 2030. The plans were announced on Friday at the 2024 World AIDS Day press briefing ahead of the commemoration on December 1. According to the conveners of the event, the agency will take the right path to sustain HIV response in the state.
This year's theme, Take the Right Path, Sustain the HIV Response and Stop AIDS among children in Nigeria by 2030, is a clarion call to action that underscores the urgency of sustaining the gains achieved while prioritizing children and gender equity and also upholding the principles of gender equity and human rights in HIV response. It compels us all to ensure that every child, every family, and every community in Lagos State and beyond has access to the care, dignity, and protection they deserve. In Lagos State, we have made some remarkable strides in the fight against HIV through the combined efforts of government agencies, implementing partners, community stakeholders, and the resident people of Lagos State. We have significantly advanced towards the UNAIDS 95-95 targets. This milestone reflects our commitment to a robust and inclusive HIV and AIDS response, giving us hope for a future free of HIV.
From all what she has presented, the pathway to the end of AIDS as a public health threat by 2030 is already known. And the pathway is protect human rights. Until we protect the rights of all, we cannot protect the health of all. There is a strong linkage between protection of human rights and the protection of health, and also the protection of health and also the protection of human rights.
World AIDS globally is celebrated on the 1st of December every year, and then is meant to actually commemorate those who are living and dead and affected by HIV and AIDS. And we've been in this trail for over 4 decades now. And the state has achieved a milestone in the response to reduce and stem the spread of HIV and AIDS in Lagos. Like Dr. Fadia earlier said, we've actually had a sizable number of claims, over 120 thereabouts, on treatments in the state. And then, of course, attaining over 95% retention and suppression of the people who are HIV positive on treatment. And then, more importantly, the state is working with partners to ensure that these services are provided to the people who are infected by the state and providing prevention services to the general population.